We're continuing with the interview series, part of the questions that are going to highlight strengths. So if you have not watched my previous series on interview questions, what to start with, what to wear, you may want to watch the first four videos I've done that will kind of go through to where we're at now. So I'm Professor Molly, and I am a nursing professor, but I'm also a former ICU educator and education manager where I've done a lot of interviews and been in a lot of interviews myself. So you're going to have some questions around your strengths. And these questions can look at, tell us a time where you advocated for a patient. It could be just the simple, tell us what your strengths and weaknesses are, or tell us about a time where a patient or a family was very pleased with your care. So these questions can be around your strengths. So you want to have a few examples of these type of questions. When you advocated for somebody. So again, in the last part of the last series, I said, remember every time you leave clinical, leave yourself a little voice memo about some of the things you did with some specifics. That way you're going to have stories to tell, and you're not going to make these things up. The thing is that sometimes we can tell when you make some stories up, and then we can tell when you're really telling the true story. So like when you advocated for somebody, I had a really good story where a nursing student advocated because this patient had BPH and could not void. And I mean, he was writhing in pain, couldn't pee, and she advocated and kept on trying to get this man in and out Foley. And I was like, you need to write this story down, because she finally came and got me, had me go and help find the nurse to go tell the doctor, because as a nursing student, you're going to have these questions where you're like, well, I don't know. How did I advocate, or what did I do? There's going to be stories where you may have gone to get your professor and they were able to help you. And then we were able to do an in-and-out catheter on this guy. And they were so pleased with her care. I was like, you need to write this story down. This is a story you need to make sure you tell in detail of how you advocated, because this person did go above and beyond. So this is the specifics to highlight the things that you've done. If a family gave you a compliment, you need to make sure you write that down. I know it makes you feel good and that was great, but write down the story. What was wrong with that patient? What was some of the things that happened to the patient? Let's say another story was, I was helping a student take care of somebody that was on a transplant list. And we stood in there for a while just listening to her. And she just wanted somebody to listen to. And at the end, the patient gave the student a compliment. And when we left and said, I said, that was a really good story for you to remember. One, because you listened, you were empathetic, you didn't try to fix the story or the situation, but you listened. And so she was very pleased with her care. I was like, make sure you don't forget that. That's a great interview type of question. And so I say this because every little thing happens in these clinicals or in your school that can lead into some great questions that build on your strength and sometimes your weaknesses. We all have those. So use those and highlight those strengths of yours and those stories. And so I hope this makes sense. And I've got a few more little tips for you in this series. And again, I hope you land that job you want.